Hello, I'm Dr. Jason Landers from Pediatric Dental Associates and Orthodontists. We're going to take a close look at a case today of a young girl named Mia who presented to our office with what we call an underbite. And we'll talk a little bit about evaluating and diagnosing that underbite at an early age. And then we'll see how the case changes over time and evaluate the outcome at the end. Underbites are one of those bite concerns that are best treated when the patient is younger. Typically age 7 to 8 to 9 is when we would like to see these patients so that we can get the most optimal outcome, but preventing us from having to do surgery later on. Mia came in, she presented with the underbite. The main concern with the underbite was that her upper jaw was not growing quite as quickly as her lower jaw. And so we developed an orthodontic plan to address this. The early phase of orthodontic treatment to help bring her upper jaw forward took about a year, 12 to 14 months. We're able to establish a good alignment of her upper teeth, correct that underbite. After that early phase of treatment, we take the expander or the braces off, give her a break for a little while, and then monitor her growth. When we saw her back a few years later, she's now age 12, that underbite was starting to come back a little bit. So we had to develop a second phase plan to finish correcting the underbite for Mia. Even though the teeth were pretty straight, the bite needed to be addressed. So in the second phase of treatment, we used braces in combination with some elastics, and the end result I couldn't be happier with. We're able to get a good alignment of the teeth. The bite is fitting together perfectly, and Mia really couldn't be any happier with her smile. Well, thank you for taking some time to look at this case. Mia's case was an interesting one. Underbite correction can be difficult, and it a lot of times requires patient compliance with orthodontic treatment to get the most optimal outcome. Her case turned out beautifully. If you or your child is experiencing an underbite and would like to have an orthodontic evaluation, please do not hesitate to give our office a call.